that it?
Yep.
Okay, so like Stephanie said, I've been a PT for 33 years, been here for 14. I've always had an interest in water and aquatic therapy, but have in the last few years been certified by American Physical Therapy Association. And I learned a lot, even after being a PT for a long time. So what I want to start with is just a little bit of history about water. So next page, Stephanie. She's in the other room, which is why we can go without our mask. So history of water. So, you know, water's been used for medical purposes and therapy for a long, long time. The first spas were back in the Roman times. This is a picture of Bath, England, which was actually originally used, I think it was like 70 AD. And then in the 1700s, King George III built the other buildings around the spa. This water is still there. It's a natural springs. It is heated and is available to the public at a spa next door. So the actual bath that you see here is not available for swimming because it's not chlorinated or cleaned or anything. But just to point out that, you know, centuries ago, people understood the benefits of water, even though they didn't have the science behind it. All right, next page. And then a little bit more recently, we have Warm Springs with Franklin Roosevelt, you know, was diagnosed with polio, and he began to go to the springs down in Warm Springs, Georgia, and developed a whole rehab facility down there, which is still there. It's not open to the public, but there's a rehab institute that uses the water there for therapeutic use. All right, next slide. All right, so I want to talk about some of the properties of water. It's not all of them, but this is the one that applies mostly to exercise. So there is buoyancy, and then there's the density and the resistance. Both density and resistance vary with the depth and the temperature of the water. And actually all three of these, the buoyancy, the density, the resistance, and the pressure all change depending on how deep you are in the water. All right, next page. Okay, so here's just a quick little chart about buoyancy. You know, our pool here at the Duke Center is 3.5 feet deep. So unless you're over 7 feet tall, you're probably going to be in water up to about your waist. So that means you've got about 50% of your body weight unloaded to all your joints below the water level. All right, next slide. All right, so going on to resistance. This is a big one because water is so much more dense than air, 700 times. Now that's a little bit different with salt water versus fresh water. And our pool is closer to fresh water, even though it's a saltwater pool, than it is the ocean. But so with that resistance, you know, everything you do under the water offers you more workload than on land. So the faster you do an exercise, the more workload you have. And of course, your body position can change that resistance. And then you can use the properties of drag to change the resistance and the workload. All right, next slide. So pressure, hydrostatic pressure is directly related to the depth and density of the water. Of course, like anybody that's been snorkeling or scuba diving knows, the deeper you go, the more pressure there is. But the hydrostatic pressure is another big plus for water exercise. And I'll go into that more later, but it's a very positive thing for many effects. All right, next. So the benefits, go through these independently now: buoyancy, resistance, and the hydrostatic pressure from the water. All right, next. All right, so benefits, like I said before, it unweights your submerged tissue. So when you're in the water, everything that's under the water has less pressure, less stress to the joints because of the buoyancy. So that means the joint surfaces themselves, the tendons, the ligaments, the muscles, the fascia, all that has less stress because it has less of your body weight on it. And that allows for greater ease of movement. It's kind of corny, but you know, when you move in the water, it feels so fluid because obviously you are in water, but that reduces, you know, your stiffness, and it reduces the stress to those soft tissues, and that can really improve your range of motion. All right, next slide. All right, so everything you do under the water offers resistance. So you get a full body resistance of anything that's submerged. You can change that a lot simply with, if you have an open hand with your fingers spread versus a paddle hand where your hands are more like a paddle. And then you can use props like gloves, paddles, the dumbbells, the noodles, kickboards, fins, cuff weights. So there's many different ways to change the resistance with the workload. All right, next slide. All right, so now moving on to the hydrostatic pressure. So water exerts about 0.43 pounds of pressure per foot. So in our pool at the Duke Center for Living, that would be about 1.5 pounds of pressure on all the tissue that's submerged. Now, that's a pretty big deal. A lot of people wear compression socks and stockings to decrease their swelling and increase their blood flow. So the pool basically does the same thing. And of course, the deeper you are, in other words, you have more pressure on your feet than you would on your hips, but that's good because your feet are the most dependent. So that helps with simple edema, it helps with lymphedema, many different swellings from surgeries or injuries. All right, next slide. All right, so here we go with the big benefits of the hydrostatic pressure. This is one that's often overlooked and people don't really think about, but it's been really impressive to me because of working with people in years past with significant cardiac and pulmonary dysfunction, and then working with people here in the water. It's night and day what people can do in the water versus on land. So what the benefits of the hydrostatic pressure does is it improves your blood flow. That water pressure takes and presses the fluids that are in your veins centrally. And that helps with increasing your stroke volume. So stroke volume is the amount of blood that's pushed out of the heart, that's pumped out of the heart, every heartbeat from the left side of the heart. And that alone, just the increased stroke volume, decreases your heart rate, which is another good thing about working out in the pool. You can have a lower heart rate. All right, and so then also that decreases your blood pressure because you get more efficiency in the heart, which allows the blood pressure to be lower. There's some, variation in that depending on the amount of work that you do in the water and the temperature of the water, but overall, it's been shown, water exercise has been shown to decrease your blood pressure for up to an hour after you get out. And then all those together increases your cardiac output. So that just basically makes your heart much, much more efficient exercising in the water. Okay, next slide. Okay, so the next one is the decreased stress to the joints, musculoskeletal, increased work to the muscles, and improved blood flow to the muscle. So like I said before, if you're in the water and you have a sore knee or an arthritic ankle or foot or knee or hip or back for that matter, you're decreasing the load to those tissues by half. But you're increasing the work to the muscles because of the resistance of the water. So you're getting more work with less stress. And then on top of that, with that improved blood flow from the hydrostatic pressure, muscles that are either injured or working, the muscles are working hard to get stronger, you're increasing their nutrition and you're increasing their ability to take away the byproducts of stress or injury. The muscle physiologists call it the debris, they call it physiological cellular debris. So if you have a bruise or you have an injury from a sprained ankle or a twisted knee or something, that tissue makes byproducts that your body has to get rid of. So that improved blood flow helps flush that out. And it also helps bring in more nutrition to those muscles that are trying to heal. All right, next. All right, so bottom line is the exercise in the water puts a lot less stress on your heart. I've worked with people over the years that can't walk one lap on the track, 300 feet. They can't walk 300 feet on the track, but they can walk in the water for 45 minutes without any problems, no need to rest or anything. And it's all because of that cardiovascular efficiency. And there's a lot of different studies out there that cite this, but in general, they think that, vertical water exercise, not swimming, but vertical water exercise improves your cardiovascular system by about 20 to 30%. Again, that's, that depends on the depth of the water, how hard you're working, and the temperature of the water. So it's a very safe way to work if you get shortness of breath because of, some mild heart failure from some atrial fibrillation, things that you might not necessarily be able to get on an exercise bike or walk for exercise because you get short of breath. And that can be dangerous if your heart's not being very efficient. You don't want to push your heart when it's not efficient. So it's safe to work in the water because your heart is so much more efficient. You can get more exercise with less stress to the heart. All right, next. All right, so here is the biggie. In my opinion, the balance exercises or the balance things we can do in the water is absolutely the best. So of course I am prejudiced because I like the water, but there's many, many studies out there that show that the water is the ideal place to work on the balance for many reasons. Because the water, when you're in the water, you get that pressure, again, that hydrostatic pressure that helps hold you up. That gives you a little bit longer time to react if you're being challenged and you start to lose your balance because you've got that density holding you up. But yet when you lose your balance and your body's trying to react and keep you vertical, the muscles that are firing up right away are having to work harder because they're working against that resistance of the water. So it's win-win. And then the best thing about working on balance in the water, you can't fall down, period. Okay, next one. Okay, so as a PT with balance, if I'm trying to challenge people's balance on land, we know that balance is complicated. There's lots of different systems that work together to keep us vertical. So there's lots of different ways to challenge balance, but all those systems need to be overloaded or put outside their comfort zone to train them. So if you always walk on level surfaces, and then you start going across a rough field where there's, holes or molehills or whatever, that's a stressor to your balance. Well, that might make you fall down. So the thing we have to do in PT is to try to overload those systems, but we're responsible for keeping you vertical. So it's harder, in my opinion, to overload somebody's balance effectively or efficiently on land because I have to make sure I can catch them or make sure they don't fall. So it's that comfort zone on land is smaller than what we can do in the water. All right, next slide. All right, so obviously you can tell I think the water is great, but here are some contraindications. These are things that people cannot get in the water. If you have a fever or you've had a recent stroke, TIA or CVA, if you have blood clots that are not being supervised medically, in other words, you're not on any anticoagulants, if you have an uncovered open wound. So the American Physical Therapy Association and other governing bodies for getting in the water with wounds say that you should be able to cover the wound. There's lots of waterproof bandages that are safe and that are effective and that stay on in the water. But anything bigger than 2 or 3 centimeters, if you've got a bug bite, you've scratched, no big deal. But if it's bigger than a bug bite, then you need to have some sort of dressing over it. And you definitely don't want to get in the water if anything is infected looking, just because of the risk of the infection in the water. And then, of course, if you have diarrhea or bowel incontinence, uncontrolled seizures, and an uncovered port site. So people that have portacasts for medicines, chemo or IV medicines, antibiotics, things like gastrointestinal tubes, those are all have to be covered. And again, there's lots and lots of materials that you can cover port sites with that are waterproof. Of course, all that, requires your doctor's permission because ultimately they're responsible. So, but there are ways around those wounds and that whole topic of, ports and wounds that are really easy to do. Okay, next. Okay, so what do you need for aquatic physical therapy? You need to have a doctor's referral. It doesn't have to be your, it can be your primary care doctor, orthopedic doctor, any physician. And that's primarily because Medicare requires that. Now, other insurances don't necessarily require a doctor's referral. And you need a bathing suit and a towel. Now, that being said, right now, we don't require that you have any kind of shoes or anything like that, but sometimes if you're going to use exercise in the water as your main mode of exercise, shoes are always a nice plus to have because they give you support in the water. They help you with, you know, the slippery surfaces in the water, in the locker rooms, or on the pool decking. So sometimes shoes are good. All right, next. Okay, so back to the COVID. So this is straight off the CDC website. So there's no evidence that COVID-19 can be spread through humans to humans through the use of recreational waters. So if you're following safe swimming practices with social distancing and everyday preventative actions to protect yourself. So basically what the CDC is saying that, you know, if you are in the water, you should try to stay away from people if you don't have a mask on. Obviously, if you're swimming, then you can't swim with a mask on, but we're not talking about swimming here. So in aquatic therapy, we all do wear masks, and the social distances, you know, can vary depending on what we're doing, but for the most part, if both of us have masks, it covers the CDC requirements. All right, next. Okay, so what the Duke Center for Living is doing is great. They are wiping all the shared surfaces, which they have eliminated. You know, they have limited the shared surfaces by taking out the chairs, blocking off the locker rooms. So there's no locker rooms, showers, the water fountain, or chairs. There is one chair at the end of every lane for the lane that you reserve or that we're working in, and that chair's, you know, we're wiping off in between, and the restrooms are available. But other than that, there's not really that much opportunity to contaminate anything or touch anything that anybody else has been in. All right, next. Okay. Before I get into this, let me tell you a few more things. So the other thing about the pool, the saltwater pool, is that it is chlorinated. A lot of people don't think because it's a saltwater pool that it has the chlorine in it, but you know, the water is run through a salt filter that has an electrical charge that changes the salt to a type of chlorine, and that is constantly being circulated in the pool. Therefore, it is disinfected and it is chlorinated at the same level as a pool that has chlorine in it, except that because it is a more steady and constant flow, there's less of the chloramines, which is the evaporated part of the chlorine that you smell. So, and you don't smell it on your skin or your clothes. And it's also because it's a more constant level and they're not having to shock the pool with dumping chlorine in the water. There is, it's less harsh on bathing suits and skin. So just be reassured that it is still disinfected at the same level as a chlorinated pool. It's just in a different way. Okay, yeah, thanks, summary. So, in summary, aquatic therapy is very safe and effective. It includes, you know, gait and balance, pain, muscle weakness, joint problems, cardiac and respiratory limitations. There's a lot of studies out there about the benefits for pulmonary. I didn't go into it because it's so complicated, but basically we can work with people with pulmonary restrictions and they usually do really, really well. We can float oxygen tanks with their, in a steroid cooler, and so we have lots of options. All right, that was fast. Okay, that's it. So thank you. If you have any questions.